Hi everyone, I'm Susan Birch and welcome to this month's Q&A. We've got Dr. Juliana Nahas with us today, and she is a specialist paediatrician in ADHD and autism. And thank you so much for coming and sharing your wealth of experience with us.
My pleasure, Susan. I'm glad to be here.
So I'd like to just kick off, if you just want to talk a little, just for a couple of minutes, about your background and your experience with these conditions, and then we'll get into the questions from everybody.
Sure. So yeah, you know, your audience may have seen me on another podcast we did, and I'm a functional pediatrician now, but I started off as a general pediatrician in the US about 30 years ago. Then when I got sick about 15 years ago, I went to conventional doctors. They couldn't explain what was wrong with me. They told me everything was fine. All the labs are fine. You don't have a diagnosis. You just have symptoms. So go home, take some Advil and rest. And that just didn't sit well with me because I've been already doing that for many months and I wanted a different answer. So I started listening to podcasts and telesummits and things like that, and got myself into this arena where I was hearing this term functional medicine come up quite a bit. And I thought, well, I've never heard of it. Let me research it. And the more I researched, the more light I saw, and the more like I thought this was brilliant. And how come we don't learn that in medical school? And basically functional medicine looks at how does the body work. It borrows a lot of information from naturopathy, if you're familiar with naturopath science. It looks at the basic underpinnings of the cells and how the physiology of the cells works. So they're not looking at diagnosis, but they're looking at if you have fatigue, for example, that's a symptom. Well, let's see what causes fatigue. What are the underlying malfunctions of the cell that leads to fatigue? And they do specific testing, so they don't guess, but they tend to run specific batteries of tests that will reveal the health of the mitochondria, which are the motors of the cells. They're the powerhouse of every cell. And each cell in our body, we have trillions of cells, as you know, but each cell has trillions of mitochondria. So it's very complicated, but these cells actually run our metabolism. And if things go wrong, like they have too much stress on them, then our metabolism starts to slow down or starts to have problems. So that's how I managed to get myself better. I did work with a doctor and a nutritionist at the time. And within 3 months, I was like back to myself. It was amazing. So having seen the light and having a lot of parents ask me, you know, our children have this disease and that disorder. What can we do for them? That's natural. We don't want to give them medicine. What can we do that's natural? So the wheels started turning in my head, and it's like, I got to put the two together. What I'm learning from my own health and functional medicine, and now how can I bring it to pediatrics? Because there wasn't a lot of topics on pediatrics.
Wonderful. And you're making a huge impact in the in this area for these kids. Thank you. So let's start. Andrew, have we got any questions through yet? No. So let's just start talking about diagnosing. I don't know if that's the right word, but I presume that ADHD comes in a huge spectrum of different.
It is a spectrum, you're right. Yeah. And most pediatricians are trained to diagnose ADHD. So it is a spectrum. On the lower end, if you will, it's just inattention. So people who just can't pay attention, but they're not hyper, they're not restless, they don't shake or move a lot. They're just still, but their mind is worrying and moving into many, many directions, so they cannot focus. And then on the other end of the spectrum, they're extremely hyper. They cannot sit still for 1 second. They're constantly jumping around and moving around. And most kids are somewhere in the middle. Sometimes you do see ADD children and very, very hyper ADHD children, but most of the kids are in the middle, and we call them combined. So that diagnosis gets the term combined ADHD, combined type. And when a doctor diagnoses it, there's not like a test to pin the diagnosis. It's mainly we get behavioral questionnaires from the teachers, from the parents. We observe them in the office. So we get more like a testimonial, but an objective testimonial from these authority figures in the child's life to say, yeah, the child kind of behaves that way all over the place. It's not just at home. It's not just at school. It might happen at church or daycare, or other places. And then we kind of come into the consensus that most likely the child has that label. And it's just a label of the symptoms that we're seeing. So it's not a test. Okay. Yeah.
So in light of that, are there physical changes, say in brain chemistry and things like that, that go along with it? Or
there are, in Western medicine, we don't look at that. There's not like a battery of tests that will prove that these numbers match ADHD. You can do a PET scan, which is very expensive and not easily found, right? So if you go to Dr. Amen's clinic, we have one here in Atlanta and there's one in San Diego. You know, you can get a PET scan and get the diagnosis of ADD based on the PET scan, but it's not the routine way of diagnosing. So there's not a blood test or any specific test that we can do. But what I'm seeing when I run my functional tests is these children do have vitamin deficiencies, mineral deficiencies. They might have excess in copper, for example, and low zinc, low iron, low vitamin D. They might be very low in omega-3s. They might have a microbiome, which is the bacteria in their gut that's out of sync and not a very healthy microbiome. So we do see that. But we have to be, it's beyond the diagnosis. It's almost now we're looking to see, well, what is off balance in their physiology that we can rebalance, and maybe that'll help minimize the symptom.
okay, we have a question. Does it ever just go away by itself?
It's a great question, and I believe it can go away. I don't know if it by itself is the right assumption. I think people change habits and do things differently that then result in different amount of symptoms. So for example, a child who grows up and decides, I'm going to get fit and exercise, I'm going to get my sleep right, I'm going to eat healthier, and all of a sudden their ADHD symptoms are gone. It's not all of a sudden. So it's been a transition, and it's happening because they've changed the way they live. So yes, it can improve, and it can look like it's dissipated by the time a person reaches adulthood, but it's never really gone unless we're doing the right things.
Okay, next question. At what age can kids be diagnosed?
In America, we're diagnosing at age 4. So 4 years old, we can make the diagnosis. It seems aggressive to me, but there's such a push from the schools and the daycares and the parents that the DSM-5 community and the American Academy of Pediatrics decided to go ahead and lower the dose, the age of diagnosis. So they're allowing from age 4 to diagnose and treat.
Is there confusion or between just normal child behavior, you know, maybe a child, you know, has a different kind of personality, and then a tendency to want to treat that as a ADD or ADHD diagnosis?
Yeah. So children who've experienced trauma, for example, whether they've had abuse or some kind of physical trauma, they'll have PTSD. Okay. And when a child is dealing with PTSD, they have a lot of anxiety, a lot of anger, a lot of irritability. And some of that behavior can be construed as being ADHD, but it's not a clean ADHD because there's all these elements of anger and the anxiety that's underpinning their behavior. So good psychologists, psychiatrists can help differentiate, you know, what is it? Is it ADHD or is it these other things? Because it is important to find out and not give them the wrong medication, you know, by mislabeling them. Some children have sleep apnea, And, because they're not getting sleep during the daytime, they're acting more hyper because that's how they can keep themselves awake and keep themselves from falling asleep. So there's a lot of other confusing or, mimicking diagnoses. And it's part of my job as a doctor and job of all pediatricians to take a good history and to really understand what's going on in that child's life.
What age do you prefer to diagnose? Do you have sort of a better
Yeah,
range?
I think I prefer 6 and up. I feel like they've matured a little bit more from the 4-year stage where they're still toddlers at 4 years, and if we expect them to behave like a more mature child, it's not reasonable. But 6 years, they're in school and we can compare them to their peers a little bit more. And I feel like I get better, a truer diagnosis. If I say your child has ADD or ADHD, I can get a better idea from my questionnaires that it's really true and it really applies. Yeah.
I've heard that autism and ADHD are related. Is that true?
It's only true in that children with autism can also have ADHD symptoms, but not the other way around. So if a child has ADHD, that doesn't make them more susceptible to have autism. But if a child is diagnosed with autism, they can have other psychiatric labels such as ADHD or anxiety or, basically other labels. Yeah.
Is it hereditary?
ADHD is very much hereditary. Yeah, it is. But the environment plays a big role too. So there's always an interaction. I believe in something called biochemical individuality. And we are always an interplay of our genes and our environment. And that's where we can really impact the disorder or the diagnosis, because we can manipulate our environment in such a way as to minimize the expression of the genes. Yeah.
What are the common nutritional deficiencies you see? You did mention a few earlier, but
Yes, so iron deficiency.
are you there? Hello?
Yes, I just got muted for some reason.
Oh.
Iron deficiency is very common. So is zinc, and lithium can be a deficiency in a subsection of children with ADD. So if they have anger irritability as part of their picture, I would look for a high copper level or a low lithium level. Those two can impact the irritability of the brain. Omega-3 fish oils can be quite deficient in those children. They can be deficient in their microbiome, the mix of their flora and their gut. So we need to probably support them in that arena. I think protein is a deficiency we see in those children because they love carbs so much and they tend to carb overload and be addicted to dairy and wheat and things like that. So we would look at protein supplementation or improving the portions that they're eating. So the healthy fats, mainly, focusing on olive oil and coconut oil and omega-3. But yeah, other trace minerals might be an issue. And I do a hair mineral analysis, so we can look at that mineral toxicities, mineral deficiencies, and then really individualize the therapy, because maybe not everybody needs molybdenum. But if a child is really low, we can say, we'll find a vitamin that has that in there, Yeah.
And then find foods that are more likely to provide those nutrients as well.
Yes. Yeah.
Do boys and girls show the same signs of ADHD?
They can. So there is a spectrum for ADHD. It can be ADD on one end, which is attention deficit disorder only without the hyperactivity, and the other end of the spectrum is the extreme hyper child. And most kids fall somewhere in between. Girls tend to lean more towards the ADD without the hyperactivity. Boys lean more towards the hyperactive side. But it is a spectrum, and I've seen girls be extremely hyper, and I've seen boys be very quiet. And the only way we knew they had ADDs is from their Connor forms, the objective histories that we take and the scores that we do. Yeah.
I've been reading about the keto diet. Oh, and there's another question about the keto diet as well. So does a keto diet help? Is that practical in children?
It depends. I think it's a very stern diet. It's very difficult for kids to not eat carbs. And because they're growing, I'm not a big proponent of keto diet for children because I need them to grow. They need to spend energy. So they need carbs from fruits and vegetables at least. So I don't really do the keto diet in my kids, but I do steer them away from grain, especially gluten. And I do steer them away from dairy because we know the peptides, those are the breakdown of the proteins in milk and in grain that can cause morphine-like substances that cause addiction in the brain, and they crave these substances to the exclusion of eating other healthy foods. So I do, monitor that and try to steer them to eat more meats and fruits and vegetables.
Okay. What are the possible side effects of different mainstream medications, and what types of therapy may help in your experience?
It's a great question. Most stimulants, and I won't necessarily name names, but most stimulant class medication, their primary side effect are lowering appetite. What these stimulants do is they increase the dopamine in the brain so that the cells are picking up more dopamine because it's like trapping the dopamine that's been secreted from one cell to the next. And that excess dopamine helps to focus the brain, improves attention and focus and concentration, but it also lowers appetite. And it helps with settling the child down so they're not as hyper, they're not looking for other rewards from the environment, that they can focus. Sometimes it can cause a stomach ache, sometimes it can cause, low blood sugar, failure to thrive and grow, and headaches. But I think if the child is having such a high degree of symptoms, we need to either lower the medication or find a different medication that they tolerate better. And then you have a class of non-stimulant medications. Those tend to cause more sedation, I find, but they can help children who maybe don't respond well to the stimulants as a whole class, and they do better on these non-stimulant type medication.
And the types of therapy that you think might help, are there alternative therapies?
Definitely cognitive behavioral therapy by retraining their responses, their reactions. They tend, children with ADD and ADHD tend to act before they think. So it's more impulsive. They get a thought and they act on it immediately without filtering if it's appropriate or not. So slowing them down, letting them think about consequences. So cognitive behavioral therapy is a great way to retrain their habitual response to impulses, like, take a breath, count, whatever. But it does help. And together with medication, I've seen tremendous improvement. However, since COVID here in the US, we've had a huge shortage of therapists because they're so busy treating other problems that it's hard to get a child in for that. So we end up, relying more on the medication and just helping the parents do the best they can with the child at home. Yeah.
What techniques do you use for talking with kids with ADHD to get the best information and stimulate conversation so you get the best from the time with them?
So as a pediatrician, a lot of my history is actually obtained from the parents, not so much from the child. But when I'm interacting with the child, like during the physical exam, I definitely make eye contact. I try to glean from history or prior notes or something, what are their interests? I'll ask them, what did you do for fun today or at school, or some leading question that can give me that information, just to let them know I'm interested in them as a person. And I also want to find out their strengths. So maybe they're failing in school, but they're excellent at drawing, or they're excellent at sports. So I want to draw that out of them to make them feel like they're not a loser, because that's the worst feeling, right? So I want to give them a win. And based on the win, we start building on the weaknesses. So we build up the wins, and then we show them they're really a smart kid, a bright kid. They have a lot to look forward to, and we're going to help them with the math or the reading that they're struggling with.
That's probably great advice for anybody working, with these children, and also for family members and grandparents as well,
Yeah.
To help support the children and also the parents.
I think it's been harmful to label these children as bad children. In the past, they're people with a diagnosis, that's all. So if somebody had diabetes, you wouldn't say you're bad. So it's the same with these children. Just because they have a label or diagnosis, you don't want to say you're bad. You want to say you're a child of God, you're beautiful, and you've got all these talents, and you're fun to be around. And we're just going to help you with the weaknesses that you have, but we see them as a person, and we have to reflect that to them, because I think they start self-talking. So the self-talk starts becoming depressive, and they put themselves down and they beat themselves up. And we need to reverse that before they head into true depression, because I've seen that happen.
I had a question emailed into me from a client who has 2 children with ADHD. And she said that a lot of her family and relatives think the children are just misbehaving and pulling the wool over her eyes, and think she should just give them a good smack. So I'd love to hear your comments about that.
It doesn't work. We could try, but it doesn't work. And I think it teaches the children to hit back. So then they end up bullying other kids in school and fighting, and we don't want to teach them that. So the best thing to do is use other methods of parenting, more gentle methods. We can do timeout, like sit down, reflect on what you just did, and come talk to me when you figured out what you did wrong. Okay, so that gives them a minute to slow down and really go within and try to learn something from what they did. Yeah, beating kids, I mean, it never teaches them anything of value. It gets their attention, but I think their behavior is not necessarily done in malice, if that makes sense. They do it because they're impulsive. They're not thinking through what the consequences are. And so they're constantly getting in trouble. They forget that they were told you shouldn't do this or that. They just forget, and they keep doing it out of forgetfulness, not out of malice. So I think being punitive doesn't really get the message through. We have to find other ways to cue them, like don't touch the stove, or don't go outside, or whatever it is we want them to stop doing.
So does that mean keeping communication very simple? Is that important?
It is, and that you bring up a good point. Most of those kids can't remember stuff. So if you tell them 5 things to go do, they may remember the last thing you said, not the first 4, because their brain is not wired to think sequentially like that. They're very impulsive, and they've got a lot going on in their minds. So they'll only remember one thing. And even if you said one thing, for example, go up in your room and get me your book bag, they'll go up to their room, and then they'll forget, what did I come here to do? I forgot. And they'll have to come back down. And they sometimes may look bewildered, like, I'm lost. It's like, where's your book bag? Oh, I forgot. And then they'll go back up, and it may happen again. Like, it might need to be repeated several times before they remember, okay, I'm here to get the book bag.
Like me sometimes.
I think we all experience that to some degree, especially if, like, when you're really preoccupied and thinking about a lot of things, you'll find yourself forgetting, like, what did I come in here for? And those kids have that going on all the time, bless their hearts. They do have so many thoughts floating in their minds all the time that it's hard to focus and hard to remember what they're up to.
I suppose giving them positive attention and feedback on all the good things so that they have
Very important.
experiences.
So whatever their strengths are, we want to nourish and encourage. Whenever they succeed at a task, we want to encourage and praise. Like doing homework. I see these kids, they do their homework, they get it done, and they remember, they know the words. Let's say they're doing sight words, but by the next morning, they've forgotten it all and they get a 0 on the test. And the parents can't reconcile, like, we studied, we did well, we knew it yesterday. Why did we forget? It's just the way their brain is metabolizing. It doesn't seem to anchor things into long-term memory for a while. They require a lot of repetition.
Okay.
Yeah.
How do I explain my child's diagnosis to my child, friends, and family?
To the child's friends?
Oh, I'm not sure. It just says, how do I explain my child's diagnosis to my child, friends, and family?
I think as simple as possible for the child, because, even a 12-year-old can sometimes have a hard time making sense of the science behind ADHD. The way I say it in my practice, when they're asking me, I say, I wear glasses because my eyes can't focus on the computer. So I have to wear glasses. And in a way, your brain can't focus on what you're doing. So we have to help you in other ways to help your brain focus. And I just leave it at that. I make it more about focus and attention than anything else.
I really like that. That's lovely.
Yeah.
And then that will work well for describing that to friends and family as well.
Yeah.
And then they can be recruited into that process of helping the child with their focus. Yeah. Love that. How long will my child need to be on medication, or can they outgrow the symptoms? Will things improve in the future for them, especially at school?
Yes to all the questions, with a caveat. So nothing changes unless we change certain things. It starts really with our lifestyle and our diet to help improve the deficiencies or the toxicities that child is experiencing. So if a child has certain vitamin and mineral deficiencies, protein or omega-3 deficiencies, probiotic deficiencies, we want to give those to the child. We want to improve the quality of the foods they're eating. If they're high on sugar all the time and processed foods, that needs to go, and we need to give them healthy ingredients like real fruits, real vegetables, real meats, and healthy fats. They may not depend on the medications forever if we do the right things for their biology. So I've seen kids, let's say I might diagnose somebody with celiac disease, and we know gluten is a no-no for those children. So the minute I take them off gluten, their ADHD is gone and they don't need the medicine anymore. For other kids, it may take a little bit longer, especially if they have multiple things going on and toxicities we have to clear, but it can be done. And when you grow up, you kind of let go of the restlessness, somewhat of the impulsiveness, not always. So you're left with the inattention and lack of concentration ability. But as an adult, you've learned skills, you know how to center yourself, you can put music on and that helps you focus. So you find other coping skills to help you navigate, or maybe you pick jobs that don't require a lot of intense focus for long hours. Maybe you pick something that's outdoorsy or more, like I'm thinking of an artist, it's more flowing and spontaneous. So you can find ways of working through your life and finding what works for you. But you have to be an adult to make choices. Kids don't have a choice. They have to go to school. So that's where we run into trouble. Yeah.
Question from me in terms of how much testing do you do regarding, gut microbiome? Do you do stool tests, and would you run organic acid tests on these children, or
Exactly.
hair mineral analysis?
Yes. If it were up to me, I'd do all the above right at the beginning, but most families that I see don't have a budget for all these tests. So we start with tests that maybe the insurance company will cover and pay for. And if they have a budget to do one of these functional tests, then we embark on that arena, because it does give me a lot of very specific information that I can dial my therapies towards. So yeah, those are excellent. The hair mineral, the food sensitivity test, the stool test, check the microbiome, and also to make sure they're absorbing the fats and that they don't have yeast or other parasites. And the organic acid test gives me a ton of information on the neurochemicals. So I really need that info. If I'm going to create a program with supplements instead of using medication, I need those tests. But if they're going to be on medicine and we're just trying to optimize their physiology, then maybe the insurance covered test is enough.
Excellent. Go through these. How common is ADHD? Can it be misdiagnosed? What are the most common symptoms for kids?
So in the US, because that's all the statistics I know, they say that 1 out of 16 children has it. So it's quite common. So in a classroom of 30 kids, there might be 2 kids in that class that have it. The way it's diagnosed is by using questionnaires. We don't have a standard test to make the diagnosis. What I use the test for is to try to figure out the underlying function of the body for that particular child and what that particular child needs. But the diagnosis is made by getting histories. I use specialized form called the Connor forms. Other doctors use the Vanderbilt questionnaires. So we have different questionnaires we use. And based on that, the doctor can say, yes, we meet the criteria, or no, we don't. Getting a good history is very, very important. And I think the physical exam is somewhat revealing, not much, because sometimes I'll have kids that all the questionnaires are like very high scores, and yet they're sitting quietly and doing beautifully in the room with me. So there's sometimes a discrepancy in their behavior in the exam room versus how they behave in a school classroom or at home. And that's why it's important to look at all these areas when we're trying to make a diagnosis. And then remind me the third part of that question.
I have to find the question it was. What are the most common symptoms for kids?
So there's 3 prongs to ADHD. If you're just looking at ADD, attention deficit disorder, that's the only thing that we know about these children. They're not hyperactive, they're not impulsive, they just lack focus, basically. They cannot finish their tasks, they're always daydreaming. People label them as lazy when they're really not. They try hard, but they just can't seem to finish what they start. If they have combined form or hyperactive form of ADHD, they have the inattention and lack of concentration. They have impulsivity, so they take very rash decisions without thinking through what they're doing. And they're also very restless and fidgety. They can't sit still. They're constantly moving, constantly touching things, touching other people. They don't respect boundaries. They're talking out of turn. So there's a lot of those symptoms that we see these children display. Yeah.
I was just going to touch on when you were talking about the testing, actually just go back to that earlier question, sort of in regard to this a little bit as well. Do you find that the testing helps the parents understand and the caregivers understand better about the nutritional needs and the environmental needs for the children? Is that a really good use of the testing?
Yes. Because like when you take a diet history, especially in a medical office, I'm not a nutritionist, so I'm not going to delve into, every meal and break it down and go into a lot of detail. I'm just trying to get an overarching menu for the school week. Like, what do you tend to eat during the week? And most parents will say, well, they eat vegetables, they eat meats, they eat this, they eat that. Okay. So I don't hear that there's necessarily a gap in their nutrition by doing that kind of a survey. But when we test, we see, well, look, their vitamin D is low. So are they not drinking enough milk? Their iron is low. Are they not eating enough protein? So then we start seeing those deficiencies for that particular child. Like there's gaps in your diet that I couldn't get from history alone, and only the testing reveals that to me. Yeah.
How does ADHD affect the brain? What advances in medicine are being made?
I think the advances through functional medicine and the way we evaluate and treat those children. So if you see an integrative psychiatrist, an integrative pediatrician who straddles both environments, like the holistic and the conventional, you're going to get the best care. This is where the leading edge is. It's not in conventional medicine. Conventional medicine, all they want to do is find a new pharmacy that's going to create a new drug, and it's the same old again and again. Like there's probably 30 drugs in all the different classes, and they all do pretty much the same thing. As far as, I forget the question, as far as the other part of the question.
How does it affect the brain?
So ADHD is impacting the prefrontal cortex, so this front part of the brain. And if we look at, maybe this way, the hand as a simulation of the brain. So this is the part of the prefrontal cortex, and this would be the midbrain, and then you have the hindbrain back here. A child with ADHD, their prefrontal cortex is not engaged. Okay, it's not engaged. So this part is asleep. And this is our executive brain function. So this is where we filter, we can edit our impulses, we can say, don't do this, or okay to do this, or maybe it's appropriate to do this now, or maybe it's appropriate to do this later. Like all that filtering is gone, all the thinking processes are not engaged. So that's why these children can maybe read something, or you tell them a word and they know it 1 minute, but the next minute they forget it, because they're not processing here. It's all going through the midbrain, which is the emotional brain. So they tend to be much more emotionally labile, up and down. Most of them are pretty happy, but they can get angry. I've seen kids who are also very angry if they don't get their own way, and they throw tantrums and they act more immature than a child their age who doesn't have ADHD. It impacts the circuits of dopamine and norepinephrine and acetylcholine in the prefrontal cortex. So if these neurochemicals are not being produced in enough capacity to help the brain engage, then they're not going to be able to think and process and memorize like we want them to. They struggle with that. They really do try. They're not lazy children, but they just can't seem to get the wheels, to engage with one another, if you will. Yeah.
And that again is where nutrition can play a huge role in making sure that all the precursors for those hormones are in place, so they've got the best opportunity they have to produce that neurotransmitter.
And I mean, we mentioned earlier that it's hereditary to have ADHD. So if you have a parent or a family member who has it, you're potentially more likely to have it as well. I've seen people who, there was a question that came in about cesarean section. So where it's like no prior family history, but because of traumatic birth or whatever, it can trigger symptoms of ADHD and autism in children because of the stress of either the pregnancy or the birth. And so my job as an integrative pediatrician is to look, do we have the genetic SNPs that we know are connected with ADHD? Because if we do, that means there's an enzyme deficiency. And if we override that enzyme deficiency by giving more of a certain vitamin or of a certain nutrient, then we can normalize the brain function and restore normal brain function. So that's the win. And then we don't need any medicine. We can just do it with supplements and vitamins and good nutrition.
What should we ask our doctor about our child's ADHD, and how should we prepare for our first visit?
So if you're going to get the diagnosis, like you haven't been diagnosed yet, but you want to evaluate. Yeah. I think asking the doctor what their feelings and thoughts are about a holistic approach. Once the diagnosis is made, you can go even a step before, like what processes, what methods do you utilize to make the diagnosis? And if we have that diagnosis, can we look at more holistic approach, or are we relegated to just medication and that's it? Because I think most traditional pediatricians, that's all they know. That's the only tool in their toolbox. They have not studied nutrition and functional medicine. So they don't know about these other modalities. It's not their fault. If you go to a cobbler, they have their tools too, and they're not going to use a different set of tools, right? So each profession has their sort of training and brainwashing. I'm going to use that term because that's what happens in those 10 years in med school and residency. So they come out knowing, okay, these are my tools, this is my toolbox, and they don't know anything outside of that. So if you're a parent that's more holistic minded, you may want to research, like, are there integrative doctors in my area that I can go see? Because they're going to have the more general scope and be more open to entertaining, even if they don't know, if they're at least open-minded, they'll be allowing of you to go see a naturopath, to go see a chiropractor, to go see other types of healers that can combined together provide the best solution for your child.
You mentioned earlier about cognitive behavior therapy. Do you think that that kind of therapy plays an important role for these children, or, psychology, seeing a psychologist?
Yes, it does. Not alone. So it's not a solo therapy to do cognitive behavioral therapy, but when it's combined with medication or other interventions, it is definitely additive. And we see that there's significant improvement in their ADHD scores for children who do combined modes of therapy. So not just psychological, but combine it with some other biological therapy.
So with the nutrition, the environment.
Yes.
Yeah, excellent. We don't want to medicate our child. Can we just use supplements? Or is medication the best thing I can do, and I just need to accept that as a parent?
You don't need to accept that. I think looking at nutrition is number one step, to be honest, because if the child's not getting enough protein or omega-3 or whatever mineral vitamin they're deficient in, then that's where we need to start. Next step would be supplements, because now we're giving specific doses of, let's say, tyrosine or tryptophan or vitamin C or whatever we feel is needed based on testing. So we would be testing the child, and based on the test, we would recommend these supplements.
My teen doesn't want to continue medications any longer. What should I do?
How old is the child? Do we know?
A teenager, so I'm not sure what.
Teenager.
Mm.
Yeah, so that's where I would say find a good nutritionist like Susan, or a naturopath, or an integrative doctor, psychiatrist, or pediatrician that can talk about weaning the medicine and looking at diet
and do those tests as well.
Do those, functional tests, because there's definitely things we can do naturally that we don't need medicine for.
How can I tell if the medication is working? How long does it take to see benefits? And will all these symptoms go away? Was that just simplistic, wishful thinking?
It's really an individual response to the medication. So it depends on the gravity and the severity of the child's symptoms. If a child is extremely oppositional, extremely defiant, on top of being ADHD, you may see a mild improvement. Mainly, they'll do better in school, they'll remember more, they'll finish their homework, but there might still be some behavioral issues like defiance that peep through. A child who's calm and happy, but still hyper and not focusing, those kids do the best on the stimulant medicines, to be honest. And from day one, you will see a response. So there's not a delay, because you're giving the brain the dopamine and the norepinephrine and acetylcholine that it needs right away with those medicines.
To what extent does my child have control over their own behavior?
Yeah, they want to have control, but they can't. So the executive function in the prefrontal cortex just simply doesn't engage. And it takes maturing. It takes them becoming more of a teenager to have a little bit more to overpower their inability to control themselves. So a young child is just impulsive and very spontaneous. Teenagers have a little bit more self-control. And I'm talking without medicine. Like if we did no intervention at all and left them to do whatever, they're probably going to eat the wrong foods and not sleep at night and do a lot of harm to their bodies just because they're impulsive, right? So we as parents have to guide our kids, because if left to their own devices, they will dig their own grave, unfortunately.
Video games. Should my child stop playing video games?
Not necessarily. I don't think that video games cause ADHD. I think that the trap with video games is that they get such a dopamine high playing those games. You know, with every level, with every win, they're getting a dopamine release. So it's a very rewarding experience, and they become addicted to it. And so if we let them play 12 hours a day, they're never going to let go of the game. We have to say we have a time limit, put on like automatic turn off or whatever, so that you're not getting into a fight over the time limit. But I think putting time limits and restrictions and making them go outside and play is much better.
I'm a solo mum and I have 3 children. One of them has been diagnosed with ADHD and I just don't know what to do. There's a bit more. I feel really overwhelmed. I just don't know what to do.
Yes, it's overwhelming being a single mom. And when you have a child who tends to cause problems all the time, not on purpose though, they're really innocent children and they're just spontaneous and they don't think through what their actions are. It's best to get help from your pediatrician if you can start there. There's no shame in giving medication. I want to stress that. I've been prescribing medicines for 30 years now and I still do. The medicines have their place. It's just not something I want people to take and go home and forget about it. Don't just accept this as the only solution. It's a step. And it's maybe the crutch that we need just to buy us time and find other ways to help heal the brain, buy time to transition to a different menu that we're eating, get on a better sleeping pattern, just to help smooth our day-to-day interactions, make sure that they're doing well in school and that sort of thing. So it'll be less overwhelming if you can get control of the behavior. And then start building the steps toward true healing, which happens with diet and lifestyle changes.
Is ADHD a superpower?
It can be.
I love that question.
Yeah, it can be. Those children are extremely personable. They're a lot of fun. They're extremely creative. They're business-minded and entrepreneurial-minded. So it can be a superpower. Some of the biggest entrepreneurs, the Virgin guy, what's his name? Branson, yeah, high ADHD, okay? And I don't think he was ever on medication, but he eats well. And he's found the right people to support him because he's just full of brilliant ideas, but he finds people to execute on his ideas. So he's built an empire by being in his zone of genius, which is just a fountain of ideas. So yes, it can be a superpower.
And I just wanted to go back a little bit to the question from the parents needing more support. Just some sort of therapy or cognitive behavior therapy, is that helpful for parents? Is it helpful for them to learn skills for themselves with coping and to be able to pass those on?
I don't know if it's cognitive therapy or family therapy. So
right. Yeah.
maybe family therapy for the parents
Yeah.
because they're learning parenting skills through that. But cognitive behavioral for the children.
Right. Yeah.
Yeah. And it starts at 5 and up. I don't think a child younger than 5 can sit through a session. So 5 and up is when we would start.
What do you think about, stigma attached to a diagnosis and, it's one of those children? Is that, I can imagine that must be very stressful for parents and families.
Yes, it is, and we need to change that. So just like there's more opening now with LGBTQ or whatever, like there's more opening about a tolerance, right? If a child was diagnosed with leukemia or diabetes, we wouldn't shun them, right? We would accept them. We would be compassionate toward them. These children deserve the same. They're just children, but they're wired in a way that makes them more restless and not pay attention. That's all. But they're still children. They're very loving. They're very outgoing. They have a lot to offer the world. We're trying to make them fit into the school system, and which is an artificial construct. It's not really what nature provided, right? So we created that environment, and now we're forcing our kids to belong there. So what we have to remember is, yeah, these children are still divinely created, just like we all are. And they have their place in the universe. We just have to nurture them and grow them in as a loving way and accepting way as possible so that they can thrive and do the best they can as they become adults.
And I love what you said earlier about, your eyes not being able to focus, and so their brains can't focus. And so if we start to see it from that perspective, like you said, if it was a child with leukemia, we'd have a whole lot of compassion.
Yes.
And so perhaps it's a lot of this is about the rest of us learning, and understanding.
Yeah, it's society at large, and not looking at these kids as troublemakers or bad kids. They're not bad kids. They're not doing any of the behavior on purpose. They truly just forget. I don't know if I said it during the recording or not, but you can send a child up to their room to get their book bag, and they'll get to their room and forget what you told them to do there. So they'll come back down all confused and like perplexed looking, and you're like, where's your book bag? Oh, that's what you wanted me to do. They'll run back upstairs to get their book bag. It's just they forget. So if you give them multiple tasks, they're going to forget what you said. Like the first things you said, they're going to forget and only maybe remember the last thing you said. So they need very simple direction, lots of support. I think bashing on them and beating them down and telling them they're no good does so much harm, and it's not necessary, and it doesn't really build them up, right? Like it doesn't make them smarter in the way we want them to be smarter. Their IQ is fine. It's just they don't remember, and they have such a flight of ideas that they're constantly jumping from one idea to the next, and they just forget they left things undone.
Things like stickers and those kinds of rewards work well for them.
What was the first word?
Do things like giving them stickers and emojis, or having sticker books, or
yes, having a reward chart. Yeah. They work to a certain degree. I think those children really are not lazy. They do try to do the tasks that are given to them. They just sometimes fall short. I think if they're motivated, so that's where the dopamine comes in. If they're motivated or given something to look forward to, they may produce more dopamine to get to that reward. So yeah, we can definitely use incentives and reward stickers, because the more we can praise them and the more wins we can give them, they're more likely to perform that again and again.
Did ADHD exist 50 years ago, or was it a result of our environment with toxins and additives in food, etc.?
It's really a combination. It's a blend of genes and hereditary tendencies and the environment becoming more toxic, our diet becoming more toxic. I mean, when I grew up in the Middle East, I would eat bread and dairy all the time. That was my staple, right? But when I moved to the States, I no longer can eat that because everything has glyphosate in it. Glyphosate is that Roundup pesticide that's in our food. So I'm allergic to it in a way that makes me very sick. So I cannot eat those foods. And I think these children also have food sensitivities that we need to identify, and pesticide sensitivities and mold sensitivities. So that's where the functional testing is really brilliant. It reveals some of those tendencies that we wouldn't know without the testing.
How often should my child's medication be reviewed by my doctor?
If you notice that it's slipping, it's not working as well, you should go and have redo the questionnaires from the teachers and you yourself, and then have the doctor review with you what's happening. Some children, as they go through growth spurts, need adjustments, I would say every 3 months. Some kids can go 6 months, a year, and not need an adjustment. So it's very individual. And I would say the parents should watch for any lack of effectiveness. So if it was working and then it stops working after a while, it's probably time to revamp and up the dose.
I've read about GABA and brain function. Is this a worthwhile supplement?
I didn't understand.
Is GABA a worthwhile supplement for these children?
GABA.
Yeah, GABA.
GABA is one of the serotonergic supplements. It makes you feel good. It helps you relax and sleep. So if they're having issues with that department, then yes. Some of the studies that I've looked at, 5-HTP, that 5-hydroxytryptophan, was actually more effective in helping children with ADHD, almost as effective as Adderall in some of the studies. So I don't tend to use GABA to treat the ADHD symptoms so much, but I do use it for sleep issues. I tend to recommend the 5-HTP more.
Is that because it's further down the line as a precursor for?
It's just a different part of the brain. I think 5-HTP can lead to serotonin directly and to melatonin, whereas GABA is working on a different part of the brain, different receptor.
And what about the role of glutamate? Toxicity, is that something that you see or that should be looked at?
It can show up on the organic acid test. So when we look at the neurochemical part of the organic acid test, it can tell me if their quinolinate and kynurenate is elevated, which is a reflection of the glutamate. And in that case, yeah, we would want to do stuff to reduce inflammation. So those are inflammatory markers. And if we see them, it means the brain is on fire and we've got to put the fire out.
And then there are some foods that aggravate those pathways as well, aren't there? So,
any artificial preservative, food coloring, sugar, those are extremely inflammatory to the brain. So I think children who have a diagnosis of ADHD should never eat those foods. Yeah.
Should I need a second opinion or trust a diagnosis from my doctor?
So a conventional doctor is going to work in the conventional method. If you want to see what holistic medicine can offer, I would get a second opinion.
And we've done our hour, I think. Gosh, that went by really.
Wow, that was fast.
Yeah, thank you so much.
I don't mind staying longer.
Okay.
Yeah.
Would you talk a little bit about the program you have? Is that just available to practitioners, or is that something that parents can access online?
On my website, I have a free mini course. So you can access the free mini course. Anybody can access that. To work with me virtually, I think, countries outside of the US, I wouldn't be able to see the patient in person. So it all would be remote testing and that sort of thing. So that's where I would just do functional medicine. I wouldn't do conventional medicine. I wouldn't be prescribing medication, but we can do the functional tests like the organic urine test or the stool
I
testing.
can get access to those tests
Yeah.
for people
Yeah.
through New Zealand, and then they can have you review the tests
Right.
and make
So
some.
I can partner with you, Susan, and we can
make some
definitely help them. Yeah.
Because
Yeah,
you have to have a functional medicine practitioner in New Zealand to be able to get access to the testing, and so we do have a couple of companies here that provide them, but they have to have a within New Zealand practitioner. Yeah, but we could work together. I could certainly get the test and organized, and then you can do the interpretations.
Yeah.
And
I can weigh in on that. So I can be your consultant basically, but we would co-manage the patient. Yeah. So definitely we can do it that way. There's not many pediatricians that are double boarded like I am. I think there'll be more in the coming years, but it's really just burgeoning. Functional medicine caught on much bigger for adult medicine, not so much for pediatrics, but I think there's a need now, and hopefully more people will get on board. Yeah.
My child has problems getting along with other children in the playground. What can we do to help?
Yeah, that's where, you know, they tend to not respect other people's personal bubbles, and they don't listen to cues. So like a normal child, if you told them stop or move away, they will answer the call. They will just follow the directions. But a child with ADHD, they almost feel like you're inviting them to come on in more. So it's misperceived instructions and they tend to keep doing what they're not supposed to be doing, and that offends the other children. So they tend to shy away from them. So it's a matter of teaching the child to understand the cues, whether they're verbal or nonverbal, so that they can be better tolerated by the other children. Most kids are very impatient anyway. So it's like a battle of wills almost that happens on the playground.
How do you deal with violent outbursts and violent behaviors?
Yeah, those are the irritable children who have ADHD. So in those children, you know, a lot of counseling is necessary. I don't know that it clicks right away for them, but they do need the counseling. They do need the redirection in their behavior. And then we have to work them up to see what's causing the irritability. It could be a microbiome issue. It could be a lithium deficiency. It could be a copper excess. And then if they have other toxicities as well, that could trigger inflammation in the brain and irritability. So those are children, you know, a normal child wouldn't act that way. So that tells me right away, biologically, there's something that we need to pay attention to.
Excellent. And your 5 top tips. So you've talked about environment and nutrition, but would you just go through your 5 top tips and, you know, maybe just outline a few foods and and then, you know, some environmental thoughts that could be helpful.
Yes. So I see this all the time. A lot of my patients cannot afford functional testing. So we have to keep it very like broad strokes. The first thing I do is remove all sugary drinks and all sugary foods, remove processed foods next. So mac and cheese and chicken nuggets and these types of things, and eat real food. So we're going to eat real meat, organic if possible, real vegetables, real fruit, and healthy fats like olive oil, coconut oil. I also recommend omega-3 fatty acids. Let them take a multivitamin to get a mix of the B vitamins and the minerals that they're going to need. It's important to get a lot of green leafy vegetables for the folate. Their brain requires a lot of folate for dopamine manufacturing. They need protein, so they've got to eat a higher protein diet than maybe an average child. And really that's it. I mean, that's the foundation of my program. Diet wise, is we really focus on the macros would be very little grain, healthy fats, good protein, lots of fruits and vegetables, organic when possible. And then we add in the vitamins, the probiotic, the omega-3. Sometimes I'll add magnesium to help the child relax at night and sleep, or melatonin, but that's it for the basic program. And anybody can do that without a doctor.
How do you get the supplements into the kids? Do you break them open and put them in food and drink, or
No, I find gummies.
gummies? Yeah.
Yeah, gummies, or if you find it in powder, then you can dissolve it in juice or water and they can drink it. But I don't encourage a lot of juice, so usually it's just water or their milk.
And what about for fussy eaters? How do you transition a child off a more processed food diet down into more protein and vegetables?
You know, that takes more time.
Mm.
So I'm a big proponent of Juice Plus, if you've heard of Juice Plus.
No.
I think it helps. They're gummies that kids can take, and it just helps to change their taste buds to allow the tolerance of fruits and vegetables. So that's one cheating way of getting them there. The other way is to just start incorporating vegetables into foods they already like. So if they like pancakes, maybe cook some spinach or zucchini or something into the pancakes. So finding ways to incorporate the important foods that they need to eat into textures they already like. That's one way of doing it. If they're open to drinking a smoothie, you can do a lot with smoothies. Soups are another good way. So vegetable with potatoes and onions and other vegetables, but make it creamy. So at the end you add coconut milk or almond milk or dairy milk if they're still on dairy. But you make it delicious, as close to possible as the child will tolerate taste-wise, because some kids have texture issues. But it is harder with a picky eater. And lately I've been using the Juice Plus to help bridge them over to liking the different tastes.
Well, I'll have to investigate and see if we've got those options here.
Yeah.
Last question, ADHD and COVID-19. Is there anything to be concerned about if my child contracts COVID-19?
No, I don't think having ADHD makes you more vulnerable to COVID compared to normal people.
And lots of thank you very much. Such an informative session.
My pleasure.
It's been an absolute pleasure to have you here.
Thank you.
And I'll just point to everybody to the interview that you and I did together just before Christmas. And you shared a whole lot of more information there. So, and I'll make sure that we share how people can get in touch with you. Are you happy for me to share your email address, or do you want them to go through your website?
I think the website is easiest. Here, let me type it in.
Yeah.
It's CovingtonPediatrics.com. And on the site, you'll see a lot of banners and things that you can go watch the video, you can watch the webinar, you can apply for a session to talk with me. Like there's different uses on the website.
Telemedicine is just so wonderful. You know, we can connect people all around the world and find, you know, and this is such a specialized area, and I'm just so delighted to have found you to be able to send people your way and have you help.
I'll mention this. I'm going to team up with my mentor, Dr. James Greenblatt, starting in May. I think he's setting up a whole virtual clinic that's going to be nationwide. So I'll be able to see patients through that clinic. I don't have the details yet, but that's coming. That's in the works. So that will allow me to also reach out to more people who maybe don't know that there's another way, and give access to something that may be hard to drive to see me. You know, we can do it virtually now.
Well, I'd like to keep in touch with you about that myself, because then that gives me another, you know, tool in the toolbox to be able to send people in the right direction. And I can certainly help get the word out in New Zealand that you're available. Thank you so much.
Thank you, Susan. Have a wonderful day.